Namaskar and good morning to all. Honorable Lieutenant Governor, Chief Secretary, Dr. Sareen, Sangram ji, distinguished faculty members, medical professionals, policy makers and guests. I am glad to have the opportunity to address you today on the World Liver Day 2026. You may know the liver is the body's most hard-working organ. It performs over 500 distinct functions, from metabolizing the drugs and filtering toxins to producing clotting factors, synthesizing protein, regulating blood glucose. It is the only organ which is capable of regenerating itself, a biological fact that is both its greatest strength and the source of dangerous vulnerability. Because the liver regenerates, it compensates also. It tolerates. A patient can lose up to 70% of liver function before the symptom emerges. By the time jaundice or the coma appears, the disease is typically advanced. This is why liver disease is often called the silent killer. It is also why the theme this year, solid habits and strong liver, is appropriate and very relevant. Globally, approximately 2 million deaths per year are attributed to liver disease, roughly 3.5% of the global mortality. In India, estimates suggest that over 10 crore individuals are affected by some form of liver ailment, with non-alcoholic fatty liver disease, NAFLD, now most rapidly growing categories. In urban settings like Delhi, prevalence studies have pegged NAFLD at 40 to 50% of adult population. Among diabetics, that figure climbs higher. Among those who are obese, still higher. The triple burden of metabolic disease, obesity, type 2 diabetes, and dyslipidemia is creating an epidemic of advanced liver fibrosis in individuals who have never touched alcohol. Viral hepatitis remains a parallel crisis. Despite significant progress under National Viral Hepatitis Control Program, which targets elimination of hepatitis B and C by 2030, the gaps in diagnosis and treatment linkages remain substantial. The current estimates suggest that fewer than 10% of individuals with chronic hepatitis B and C in India have been diagnosed, and fewer still have received curative treatment. So I would like ILBS to steer the program in this direction. The 2026 campaign identifies 4 solid habits. First, the balanced diet. Second, the physical activity, reducing alcohol, and regular checkups. Each deserves a brief clinical note. The relationship between diet and liver health is well established. We saw the thoughtful and scientific Dawate Jigar menu. Ultra-processed food, high fructose corn syrup, excessive refined carbohydrates, they drive the fat accumulation in the liver. Diets rich in fiber, healthy fats, low in added sugar are good to reduce liver fat. Coffee, interestingly, has emerged as protective to the liver. Exercise independently reduces liver fat content even without weight loss. A minimum of 150 minutes per week of moderately aerobic activity is recommended, with resistance training offering complementary benefits through improved insulin sensitivity and reduced visceral fat. There is now a strong scientific consensus. There is no safe level of alcohol consumption for the liver health. What is often underappreciated is that even moderate drinkers who also have underlying metabolic disease carry compound risk. So the coexistence of alcohol use and NAFLD accelerates fibrosis dramatically. Perhaps the most actionable message of all, liver tests The liver function test LFTs are inexpensive, widely available, and can identify liver disease years before it becomes irreversible. Liver stiffness fibrosis can be quantified by a machine fibroscan without a liver biopsy. Our infrastructure to expand in this regard. From a public health system perspective, the Delhi Health Department is committed to several specific actions. We will be working to integrate liver-specific parameters into annual health checkup package at our government hospitals and Ayushman Arogya Mandir. This includes LFT, hepatitis B and C serology, and BMI-linked metabolic risk assessments. We will also collaborate with ILBS to train the primary health physicians, as suggested by Dr. Sareen, and health workers on early recognition of liver disease risk factors, including metabolic syndrome, NAFLD makers, and hepatitis screening protocols. We are strengthening the cold chain and immunization reach for hepatitis B vaccines, particularly in high-risk occupational groups and newborns. And we are also supportive of today's launch of 15-day Healthy Liver social media campaign, and we will also amplify it across Delhi government's official digital channels. I want to give the doctors and nurses a simple message. You are seeing patients every day who have early stage fatty liver, early stage fibrosis, or modified risk factors for the liver disease. Many of those patients walk out without a single word about their liver. We need to change that. The one habit change approach is clinically supported. Small, sustainable interventions such as replacing one sugary drink, adding one walk per day, scheduling one liver check are far more effective at population level than the large behavioral overhauls that patients cannot sustain. Let us make liver health counseling a routine part of every clinical encounter. Let us normalize the liver health the way we have normalized blood sugar test. Let us treat NAFLD not as an accidental or incidental finding, but as a metabolic issue that needs urgent attention. I endorse the theme for the World Liver Day: solid habits build strong livers, and I will also say that healthy liver would build a healthier Delhi. Thank you very much.